everyone. You know, you've all heard about the terrible twos, but when is a temper tantrum a call for attention or something more? Well, here to talk more about that is Dr. Kelly Band. She is the clinical director of Ally Pediatric Therapy. Thank you so much for joining us. We appreciate it.
Thank you for having me.
So let's talk about the fact that, you know, tantrums are common among toddlers, but there is a point when it's considered typical and when not. So first, what are the symptoms of a typical temper tantrum?
So you hear about the terrible twos a lot, and really what that is, you know, these are kids that are just now, language is emerging, they're just now starting to exert their independence, they lack logic, they have trouble with self-control, so naturally temper tantrums are going to occur. You know, the screaming, crying, falling on the floor, all of that stuff is definitely part of a typical tantrum, and I think it really, keeping in mind the duration of it, so how long does it last? It might not be much more than a few minutes at most when we're looking at the terrible two part of it.
Okay, so consistency is something that might point to something more where it's an underlying behavioral issue. So what other symptoms of something more could that be?
And this is a question that I get a lot, especially from parents and things like that. And I always direct them to three key factors: age, duration, and severity.
Okay.
So just like we were talking about terrible twos, definitely typical. When it is the severity, you know, when you start to see marks, bruises, when they start to act out a little bit more aggressively, maybe hitting, maybe pinching, biting. Those are all things that could be a part of a typical terrible two tantrum, quote unquote, but when it starts to leave marks and maybe draw blood or things of that nature, that would definitely be a cause for concern. And the other part of that is the duration piece. When, like I said, it could be up to a few minutes, but then also if it's 20 minutes, 10 times a day, and every day, all day long, you know, that would also be an opportunity to reach out.
So if you are reaching out and somebody goes in and sees you and you find out that there is something underlying going on here, what kinds of issues could we be dealing with in a situation like that?
A lot of the kids that we treat have autism spectrum disorder and attention deficit disorder, ADHD, even maybe some oppositional defiant disorder or something along those lines, a lot of anxiety, potential learning disorders, things like that.
And how do you go about treating that?
That's a loaded question.
Depending on the situation, right?
Absolutely. And it depends on the child, depends on the family makeup. Every child is going to be different, so every treatment plan is going to be different. I will say, though, that all of those disorders, the symptoms are very complex. And so in any type of treatment plan or treatment protocol, I would absolutely encourage any family to reach out and seek an integrated approach.
Okay, so what does that mean?
Treating it from multiple different disciplines so that every aspect of those symptoms is treated in its proper form.
Okay, so not just one, but you're treating everything.
Yes, absolutely. More like a systemic point of
So
view.
I know you offer consultations. What does that involve for the parent and the child?
So we offer a few different things. So we can do assessments, functional behavior assessments, and that'll really tell us what the function of the behavior is, and then we can come up with a treatment plan from there. And then we also offer comprehensive treatment, so looking at a full behavioral program using applied behavior analysis, potentially speech and feeding to really help with that communication piece and looking at those replacement behaviors, and then also potentially some occupational therapy to help with some of those fine motor or sensory challenges.
So there are some steps involved in this. The first step obviously being getting a consultation. So if you want more information, you can find Dr. Kelly Band. She is at allypediatric.com. Thank you so much for joining us. We appreciate it. Great information.